Indeed. So, Dr. Higginson, what do you think we should be looking at? What should we be doing?
Thank you. Well, I'm a relatively simple man, and I think to start with, we just need to get the basics right. So if we accept that the NHS is stuffed full of amazing people who are doing a fantastic job and could do an even more fantastic job given the resources to do it, why don't we build on that? So let's stop treating the NHS like a political football. Let's get consistent, long-term, well-thought-out plans that we keep going despite the political climate. Think it through. Let's invest in community-based services, which would include primary care and many other services. Invest in social care so that we're not concentrating on hospitals where we don't need to. And then with regard to the rest of it, let's put in those beds that we need, the information systems that we need, and crucially, we need to recruit and, more importantly, retain the staff. And then when you start talking about reform, if you put our staff in an environment where they've got the headroom, where they're not run off their feet, and where they can think properly and work properly, they will innovate, they will find the savings, they will do the things that will continue to make our health service available to our patients. Lord Winston is a classic example of that. Look at what he has achieved over his career, given the headroom to do it and given the support to do it. And the NHS is full of people who are capable of doing that. Right. So staff is the bedrock of the NHS. It needs proper planning, proper investment that's well thought through and doesn't change every time the political winds change.
OK, Ian, Rachel, thank you both very much indeed for contributing this evening. Appreciate